Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's experts will discuss the spread of avian influenza, the risk it poses to humans, and what we can do to protect ourselves. I'd like to briefly introduce our speakers. Meghan Davis is an associate professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Andrew Pekosz is a professor and vice chair of the W. Harry Feinstone Department of Molecular Microbiology and Immunology at the Johns Hopkins Bloomberg School of Public Health. We will have time for questions following our speakers' remarks. We will take some that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to panelists and host. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing, and it will be recorded. Dr. Davis, please go ahead.
Thank you. It's great to be here. What we need to recognize about avian influenza in dairy cows is that we've had issues with avian influenza in poultry for a long time, decades. The current clade has been causing disease in the United States since about 2022, and we've recently seen the spillover into dairy cows affecting a worker, many different poultry that are on the farm, wild animals on the farm, and domestic cats on the farm, as well as causing production losses and disease in the dairy cows. What this means is that we need to strengthen our One Health surveillance and response efforts in human health, animal health, and environmental health in order to better understand the scope of this problem and therefore to be able to better direct our response efforts for that, particularly for our workforce who may work with dairy cows on farm, who may milk them, who may haul the milk to dairy processing plants, may work in the dairy processing plants, or work with other affected species anywhere within that animal value chain. What we've seen is that we need to move beyond just testing our symptomatic workers who are voluntarily agreeing to participate and to test just the symptomatic cows or the cows that are being moved from one state to the other. And instead to see just how widespread this might be, not just based on current symptoms and shedding of virus, but moving into methods that let us understand what humans and animals have been exposed in the past, whether or not they had symptoms. What this means is moving into testing for antibodies. We recognize that there may be many barriers for the workforce who may be migrant or immigrant workers who may not speak English to participate in these studies. And so breaking down those barriers, making sure that we deliver them good PPE, personal protective equipment, so that they are protected against exposure, and also empowering them as our front lines for surveillance is very important. We also know that it may be a little bit challenging or uncomfortable for people to give a blood draw for what would be serology, that is, testing the antibodies within the blood. But there are alternative methods available, including salivary antibody testing that colleagues of ours have used within many studies of hog and poultry workers. So there are ways that we can engage with them in that way. We also need to scope out to other barriers that might be at the farm level. For example, it may be a financial disincentive for dairy producers to participate in these if they are going to lose production, meaning they're going to have to take the milk and discard it if they are a positive farm. So the new indemnification programs that the USDA announced on Friday are a good step towards that. You could argue if we had assured them sooner, maybe we would have gotten buy-in a little bit sooner. But by compensating producers for this loss of milk and for other different things that they need to do in terms of providing their workers with personal protective equipment, I think that can help lower some of the barriers. We also need to think about other people who may be at risk. and this includes our raw milk consumers, which we know are a small but vibrant community. And we also need to think about the use of raw milk in pet food products. And so feeding pets raw milk could be very problematic, given that we know on dairy farms that cats on the farm that have been consuming the raw milk have been getting very sick with neurologic as well as respiratory disease and high mortality. If this were to get into our pet animal species, not only would that be a concern in terms of the virus and its potential selection for changing to be more adapted, which is something that we would not like to see, but it also could expose people in a very different way than we would see in the workplace for our dairy workers or for the consumers. Finally, I think that one of the most important things to recognize with this outbreak is what an opportunity it offers us to strengthen our systems for spillover detection, response, and mitigation. So what we would like to see is for this virus not to adapt further. Although certainly if it does down the road, we need to be prepared for that. And this is exactly the opportunity that we need to take in order to do so. Thank you.
Thank you, Dr. Davis. Now we will hear from Dr. Pekosz. Dr. Pekosz, please go ahead.
Thanks for the opportunity to speak on this topic. The H5N1 avian influenza virus has been a public health concern since 1997. Every few years, we see a resurgence of the virus with large numbers of wild migratory birds being infected and subsequently spreading the virus globally. Since 2022, the H5N1 virus has spread particularly quickly in migratory birds and has also spilled over into several mammalian species, including sea mammals, bears, foxes, domesticated cats, and now dairy cattle. Every time an H5N1 virus infects a mammal, it represents an opportunity for the virus to adapt to be better at infecting and transmitting between those mammals. Given that dairy farms have a large number of people who can come in contact with infected cows, there is an increased chance of the H5N1 virus also directly infecting humans and beginning that process of adapting to replication and spread within humans themselves. Now, scientists have been able to sequence the genes that make up the H5N1 viruses infecting some of the dairy cows and other animals, and that data suggests several things. First, all the viruses associated with dairy cow outbreaks are highly related to each other and most likely represent what we call a single source outbreak, meaning there appears to be one farm in Texas is the place where the first cows became infected with this avian influenza virus. The subsequent spread to other dairy cows and transport of infected dairy cows to different states can pretty much account for most of the virus infections that we've detected in the 9 states that are currently been reporting these cases. The virus has picked up some additional mutations, but does not appear to have acquired key mutations that would allow it to infect humans with greater efficiency or transmit from humans, at least up to this time. Besides spread from cow to cow, other animals on infected farms have been infected with dairy cow virus, and this includes cats and domesticated poultry. It's believed that this has occurred through the consumption of milk containing live virus, since much of the milk on those farms is pasteurized off-site. High amounts of virus are detected in milk, but pasteurization seems to be able to inactivate or kill all those viruses. So while the risk to the general public is still very low, this outbreak has shown that the U.S. needs to improve its ability to respond to new and emerging infections in order to minimize the chances of a new pandemic. Primarily increased testing, including individuals and animals that are showing symptoms as well as that are asymptomatic, would really help us get a better handle on the extent and magnitude of this infection. And increased communication with workers on farms is essential in order to effectively convey not only the risk, but potential ways to mitigate that risks. Thank you.
Thank you, Dr. Pekosz. Now we will take questions. If you have a question, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. Here are the first questions from Michelle Marchante at the Miami Herald for Dr. Pekosz. We've seen more than just birds get infected with the bird flu, like cows, a Florida dolphin, and at least one human. Are these infections coming from the same strain, or is there any evidence that the virus is or has mutated?
All the infections, at least in North America, over the past 2 years or so, have come from the same, what we call clade of H5N1 virus. So they're all very closely related to each other. Now, when these viruses enter a new host, they oftentimes continue to accumulate mutations. And so we have those genetic fingerprints of the virus as it replicates in these new hosts. So it really is the same general family or clade of H5N1 viruses that have been causing outbreaks across the US and even globally over the past 2 years, with now this dairy cow H5N1 lineage being a very specific subset of viruses that are mutating and within those species themselves.
Great, thank you. Another question for you, Dr. Davis. People may be wondering if it is safe to drink milk, use it in cooking, and eat poultry and meat. Can you explain if it is safe or not and why?
We have a very strong food safety regulatory process in the United States that's governed largely at the state level with a lot of input from the Food and Drug Administration. And what those processes do is help to assure that despite whatever pathogen may be present at the beginning of the process, that it undergoes inactivation. So pasteurized milk and meats that are handled according to what we recommend for meat safety are generally going to be safe in terms of the relative safety that we can expect from food. Now, raw milk and raw milk products may not undergo the same processes to inactivate the virus. And so I have very large concerns about the safety of raw milk.
And if I can add, there are documented cases of human infections coming from eating undercooked poultry products that have been contaminated with H5N1, from coming into contact or slaughtering and processing infected H5N1 poultry. So this process of coming into exposure with infected material and consuming it is one that has been shown to represent a very high risk of infection with H5N1 viruses for a number of years now.
Great, thank you. Here's a question from Alex Knapp at Forbes for Dr. Pekosz. Has there been any indication that avian flu is spreading in cattle through the respiratory system, or does it appear to primarily be through contact with birds or milk?
Yeah, this is a critical question that is still under investigation. I think it's quite clear that there are most likely two ways this virus is spreading. There probably is some respiratory virus spread in the way that we traditionally see respiratory viruses spread. But we also have a strong suspicion that the virus is being transferred from one cow to another through the milking instrumentation that's used to draw the milk out of the animals. What we really don't know is what's the contribution of these two methods of transmission to the current outbreak. Is it 50-50? Is it mostly milk? Is it mostly respiratory? Those are experiments and information that we really need to get a better handle on so that we can effectively put in those mitigation methods to limit that transmission.
And to
Yeah,
that
I'll add
point,
to that.
oh, go ahead, please
Sorry,
go
I'll add
ahead,
to that,
Dr.
Andy.
Davis.
Yeah, just in terms of what we need to do for exposure assessment, meaning how we measure the virus through these different media, through the air, through the milk, also should include testing of manures from dairy cows to see if they might be infectious, given that we recognize that a lot of these manures are part liquid, and this may be sprayed onto crop fields or onto fields that are adjacent to places where you might have raw crops or fruit products that could potentially become contaminated. Now, I think it's lucky that this is an enveloped virus, and so inactivation in the environment is something that we expect to happen over time, but we don't know the dimensions of that, and without knowing that, it's hard to really understand all the different routes of exposure, not only within the farm, but from the farm into surrounding areas.
Great, thank you. Here's a question from Gabriel Emmanuel at NPR for Dr. Pekosz. How have other countries, particularly Asian countries, dealt with bird flu in the past, and what can be learned from their response?
Well, previous to this dairy cow outbreak here in the US, the primary way that H5N1 has impacted human populations is really through infection of poultry. And while this virus can infect migratory birds with causing very little symptoms, in poultry, it's an incredibly deadly virus. The virus spreads to organs like the brain and other organs, and usually results in poultry death within a matter of days. So in other countries, when they've seen these poultry outbreaks, really the method of control has been to cull infected populations. And in the case of live markets, which are common in certain parts of Southeast Asia and other places, to try to close down live markets so that you minimize the chance of people getting exposed to potentially infected poultry. Again, the dairy cow situation is something that really only emerged this year in the US. And so I think the world is really looking to the US for leadership in terms of how to understand the transmission that's going on in this population and to come up with effective ways to limit the transmission as well as maintain the safety of the food supply.
I can add just briefly, in Southeast Asia, there have been some strategies that use environmental measures for control, including rest days. So taking a market, making sure all the animals are sold or brought back to their origin or depopulated, and then leaving that area completely empty for a period of time. And so I think that that's something that's important to remember, is that there are these environmental routes of transmission.
Great. Here's a question from Michael Stobe at Associated Press for Dr. Davis. The current clade has seemed highly lethal to birds, cats, and some other animals, but not to the cows, or so far to the 2 human cases reported in the United States. What are some possible reasons it's been so deadly to some animals, but not to dairy cows and people?
I think we're still understanding the pathology. What we recognize is that the cows are getting sick. They have lesions in many different parts of their body, including the gastrointestinal tract and the mammary glands themselves. So the udders do get really inflamed, and that causes changes in the milk, which I think is actually quite lucky for us as consumers, given that it's a practice on dairy farms when cows have milk that is really inflamed, never to put that into the tank that goes to human consumption. In fact, there are financial incentives to keep milk that is what we call high somatic cell count out of that tank. What will happen over time is a big question. And I think the more that we see spread within cows, the more we may see changes within the virus. And I'm sure Andy can add to this in terms of how this might be good. It might make the virus less pathogenic, or it could do the opposite and it could become more pathogenic. And we might see more disease or animals affected that we don't currently see affected in the current outbreak.
Great, thank you. Here's a question for you, Dr. Pekosz, from Tina Say at Science News. What do recent genetic analyses reveal about the spread of H5N1 in animals? Since cattle have passed the virus to cats and raccoons, does that raise the risk of it infecting and transmitting in humans?
We're unsure of what the implications are for transmission among humans, but it's certainly important to understand that on a dairy farm, it's not just the cows that individuals should be weary of. Coming into contact with other animals who may have been exposed to infected milk and subsequently been infected also represents another place where an individual could come in contact with the virus and acquire an infection. We still don't know if the transmission between cows makes the virus evolve in a similar way that would improve its transmission in humans. It's a very tricky set of experiments that need to be done. But what we do know is that we don't see the genetic signatures in the virus of anything that we've previously shown to be one of the things that we need the virus to acquire to replicate in humans. One of those is binding to a particular cell surface receptor, sialic acid, the 2,6 sialic acid acid is what human viruses bind to. Avian viruses bind to 2,3 sialic acid. That's a subtle difference, but all the viruses from cows so far, as well as some of the other animals infected with the cow viruses, have maintained the ability to bind the avian receptor. So there's a good piece of news. It's that hasn't changed very quickly after this outbreak. But again, we worry about any transmission between mammals because humans are mammals. They're not cows, but they are mammals. And so therefore, anything that helps this virus transmit among mammals has the potential to increase transmission among humans.
Great, thank you. Here's a question for either of you from Alice Callahan at the New York Times. Is there any concern about the safety of the water supply?
I think that's an interesting question and is something that, in terms of our environmental monitoring, would be important to test, given that, at least in rural areas where we have high intensity dairy production, we may have runoff of manures and potentially even other products, including spilled milk, into local waterways. And we don't yet know the survivability of the virus in this particular case under those conditions. What we do recognize is that one of the ways that wild birds can get infected is through water. So you may have one of the reservoir hosts. These are the animals that don't get really sick, but tend to carry the virus and help circulate it. Maybe in lakes or ponds, and other birds come in and are exposed through the water. So let me see what Andy would like to add to that.
Yeah, Dr. Davis hit all the important points there too. Chlorination should inactivate any virus that's in the water treatment paths. So I think in terms of the water that all of us, drink from our homes, there's a high level of assurance there that that water will be safe. But the way avian viruses transmit in nature is through what we call the oral fecal route. Virus that's excreted is then present in the water. Other migratory birds pick that up and get infected in that way. So understanding the environmental consequences of having all these new animals being infected and where their waste milk goes, and understanding how that might contribute to spread to other animals is an important part of this outbreak that needs to be studied more intensively.
Great, thank you. Here are two questions from Helen Branswell at STAT for Dr. Davis. Can you talk about the prospects for using vaccination to control spread in cows? Would there be trade implications? Also, how can we make sense of such a high rate of PRC positive commercially purchased milk if farmers don't put abnormal milk into the human milk supply?
Yeah, I'll start with the last question because I think it's important that we recognize that because we can detect the genetic code in the milk, not meaning that's viable, but just that there's evidence that it was there, that indicates that there are farms that are positive that we may not know about. And we recognize that because we know that with the positive farms, the milk's getting diverted. And we also recognize that probably the cows with the most affected milk are not going into the milk supply. So that suggests that we need to be looking more at these asymptomatic cows and also at farms where we have not necessarily recognized that have had symptomatic cows that may be positive. This is important because if we understand how widespread the problem is, that can help inform our mitigation and control strategies, which could include vaccination. We know that there is a commercial vaccine that's been available globally that's not necessarily tailored to this particular clade, but that in the United States, we've had, I think, multiple groups that have been working on development of the vaccines for poultry. But some of these are a little bit complicated by the potential for trade barriers. And the concern here is that countries may be testing products, and if they detect a positive, they may not be able to identify the difference between a product that comes from a vaccinated animal and a product that comes from an infected animal. Now, our fluid milk market is not super global, right? We tend to think of fluid milk as something more regional, but there are other products like cheeses that could be impacted. I think this is a perhaps slightly larger deal on the poultry side. but you'd have to really look at the specific agreements as they relate to each commodity to really unpack it. It's a pretty complicated thing. I'll just add one note that the World Organization for Animal Health, or WOA, which was formerly OIE, is the governing authority for animal health globally and has made recommendations that countries not use vaccination status as a criterion in trade restrictions.
Great, thank you. Here's a question from Sophie Gardner at Politico for Dr. Pekosz. Where do we stand with H5N1 vaccines for humans? I believe there are several vaccine candidates. How effective would we expect them to be?
Well, for many years, we've been looking at avian influenzas as a potential next pandemic because of our history of understanding that previous influenza pandemics derived themselves from avian influenza viruses. So the US government and other governments have tested and made stockpiles of certain avian influenza viruses and taken them through the first step of putting them into the vaccine production pathway. So certainly there is at least one H5N1 vaccine candidate that is essentially ready to be moved to manufacturers to produce large amounts of virus should the need be present. And work from a couple of academic laboratories has shown that the antibodies generated from that vaccine do cross react and recognize the cattle H5N1 viruses. So there are stocks of viruses that could be moved into production relatively quickly. The production for seasonal influenza viruses takes about 4 to 6 months, so there is a time lag there. But we also need to think about new technologies such as mRNA vaccines, which could speed up the process tremendously. And we've now got a lot of experience in terms of using those vaccines in humans. And there's also a long history of testing influenza-based mRNA vaccines in humans and in animals. So I think that we're much better prepared to react and respond to a potential H5 pandemic than perhaps we were against COVID-19, because we've had several years to prepare and think about ways that we could speed up that process and get better prepared to deal with it.
Great. Here's a question from Joe Nell, Alicia at the Associated Press for either one of you. Why have we only seen confirmed detections in 9 states to date, even as more herds are confirmed? Are we just not testing enough in other states? Dr. Davis, you want to start?
Yes, I can start with that. Certainly, you have to talk to the states in terms of the individual states. I think the wastewater surveillance suggests that it may be more widespread, and the detection of the virus in milk in an inactive state suggests that it may be more widespread. What we don't know is if this is because the dairy producers and the workforce are hesitant to really interact with governmental officials in terms of the testing, if the lack of incentives has been a barrier. And what will be really interesting to see is if, with the new incentive structures that were released by the USDA on Friday, and also the release of additional personal protective equipment from state and national stockpiles, if that will A, better protect the workforce, and B, help them be more willing to participate in these programs in terms of the testing. So stay tuned.
Great, thank you. Here's a follow-up from Alice Callahan at the New York Times for you, Dr. Davis. Do infected farms have elevated somatic cell counts in their bulk tanks? Can that measure be used as a quick screen to look for herds with asymptomatic infections or who haven't otherwise been identified?
It's a theory I have, but I have not yet seen data released by the USDA on this particular point. Certainly what we do see from the pathology, so this means the reports on the disease in the cows, is that they do have what you would consider to be colostrum-like milk. Colostrum is the first milk that a cow gives to her calf when she, has the calf. And it tends to be very, very high in antibodies and cells. And so that suggests that somatic cell count is probably elevated in cows that have the most affected tissue in the udder in terms of the infection. I've wondered if we could look at bulk milk tank samples as another source of surveillance. We need to test this. We need to know, is it possible to detect smaller quantities of virus from these bulk milk tank samples that are already being collected by dairy processing plants when the milk truck driver goes to the farm to take the milk to the processing plant. And the reason this is done is actually for other regulatory purposes. It's done because we don't want residues of antibiotics and other drugs in our milk. And so that would be considered an adulterant. And these samples are collected for that purpose. But could they be co-opted for this kind of testing? And could we use somatic cell count increases that are above expected as a potential rationale to target some of our testing? We'd need to test that.
Great,
And
thank you. Andy, Dr. Pekosz, please go ahead.
yeah, I'll just quickly emphasize a point that both Dr. Davis and I have made. We need more testing, but we need to make sure that the testing is done in a way that doesn't stigmatize, that doesn't make any kind of additional burden on these farmers. The farmers need to have the buy-in to realize the benefits of this testing. And we need to also think about new technologies. Everybody knows that how amazing the at-home COVID-19 tests were in terms of helping to us identify infected individuals. That technology can be applied to avian flu and utilized on site to get more accurate and less invasive type of testing going on. So we need the buy-in. We need to communicate effectively with all these parties that are involved in this to get more testing so we can get our hands around the extent and the magnitude of the problem.
Andy, if I were a dairy producer or veterinarian, could I get a cow side test so I would know when to keep her out of the milk tank?
There's no reason why we couldn't develop a cow side test just like we have for COVID, just like we have for seasonal influenza.
Perfect. That's a great note to end on. And thank you to you both for your presentations and fantastic answers. We will email the links to the resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.
Great to be here. Thanks.